Hi, everyone. This is topic 2 for my podcast, which is therapeutic relationships in mental health. I chose this topic because my mental health placement challenged many of the assumptions I had before entering the clinical setting. Before placement, I was nervous and had a preconceived idea about what working in mental health would be like. However, after spending time with my patients, I realized that most meaningful part of nursing wasn't just completing tasks or administering meds. It was building therapeutic relationships. Simply taking the time to listen and be present and treating patients with dignity often seem to have a significant impact on their experience. And then the first article I found by Moreno and Rodriguez, 2021, explored the relationships between empathy and therapeutic relationships in mental health nursing. And then one of the biggest takeaways for me was that empathy is strongly associated with stronger therapeutic relationships and better patient experiences. Reading this article reinforced something that I observed during my placements, which was patients were often more willing to engage when they felt genuinely listened to, respected, and understood rather than judged. And then the second article I found by Wengel et al. Discussed the core elements of psychiatric and mental health nursing. They emphasize that therapeutic nursing requires time, honesty, engagement, trust, and meaningful relationships rather than simply focusing on completing clinical tasks. This article resonated with me because it reflected the type of nursing I witnessed during placement. Some of the most impactful moments came from just conversations with my patients, where nurses and myself took time to understand their unique experience and just instead of just focusing on their diagnosis. Looking back through a lens of relational inquiry, I learned that every patient brings their own experiences, relationships, and circumstances into the healthcare setting. And then relational inquiry reminds me to move sort of beyond just seeing their diagnosis and just understanding the whole person. It also encourages me to recognize the power imbalance that exists between nurses and patients and the importance of creating safe, respectful relationships built on trust and empathy and collaboration. One question I continue to explore is how nurses can consistently build stronger therapeutic relationships in the healthcare environment when heavy workloads and time constraints can make meaningful conversations difficult. This is also something I notice in my work as a PSW. It's something I can hope to continue learning as I develop my own nursing practices. And overall, this topic reinforced that therapeutic relationships are one of the most important and powerful interventions nurses have. My mental health placement showed me that empathy, presence, and just genuine human connection can be just as important as clinical skills. And as I continue becoming a nurse, I just hope to build trusting relationships with my patients and provide care that recognizes the whole person and not just their illness.